Well, good morning. I am pleased to be joined this morning by Director Alibo from the Department of Education and Dr. Badati from the Iowa Department of Public Health to give an update on the return to learn work to reopen Iowa schools. First, I want to give my heartfelt thanks to the hundreds of districts and non-public schools around Iowa who have worked tirelessly on their return to learn plans to provide a safe learning environment as we resume school this fall, and to be prepared to adjust their learning models based on the criteria in their communities. Make no mistake, this has been a formidable task that truly is bringing out the best in Iowa resolve, adaptability, and innovation. The fundamentals of our return to learn strategy are safety, flexibility, and parental control. This plan starts with the foundation of in-person learning in alignment with Iowa statute, requiring that 50% of instruction time occurs in the classroom and prioritizes core subjects. Schools have flexibility to meet that and other options if public health circumstances occur, making it an unattainable goal for them. Our plan also puts the decision on whether or not a student learns 100% through remote learning in the hands of parents, recognizing differences between students and families and how their student best learns or what some of their other family circumstances may be. As the CDC stated, schools are an important part of the infrastructure of our communities. They provide a safe, supporting learning environment for students. They employ teachers and other staff and enable parents, guardians, and caregivers to work. In Iowa, 70% of married households are dual income households, and that doesn't even include single parents out there like Lydia from Ankeny. We need to keep our next generation learning, growing, and preparing for a bright future. And online learning is an essential component of that, but it can't make up for the critical role our schools play in the development of social and emotional skills that our children rely on. We also have to be mindful of the achievement gap of underprivileged students and how disparities that exist in online learning resources could serve to worsen that gap. And it's often those same children who are far more likely to rely on school-supported resources, again, disproportionately impacted. Recently, Dr. Redfield, the head of the CDC, reminded parents, teachers, and decision makers to consider the substantial negative public health consequences of children not being back in school. He rightly observed that it's not an issue of school openings versus public health. It really is public health versus public health. After 6 months of the pandemic, there's also mounting research that shows children are less likely to transmit and contract COVID-19. According to the CDC, among nearly 150,000 cases of COVID-19 in the U.S., between February 12th and April 2nd, only about 2,500 or 1.7% were in children. This weekend on Face the Nation, U.S. Surgeon General Jerome Hill said that schools in communities with less than a 10% positivity rate should reopen. On a 14-day rolling average positivity rate, 93 of Iowa's counties, including Polk, Lynn, Dubuque, Scott, Woodbury, and others, would meet that definition. Finally, recent research published in the peer-reviewed journal Pediatrics concludes that children infrequently transmit COVID-19 to each other or adults, and that schools, provided that they practice social distancing and consider rates of transmission in their community, can and should reopen this fall. So key takeaways: COVID-19 poses low risk to school-aged children, based on low transmission in the community. Children are not driving the pandemic, and transmission from students to students and teachers have been low. With proper tools and resources, we can reopen safely, protecting students, teachers, staff, and families. The vast majority of Iowa school districts had already developed plans that align with in-person instruction as the primary learning model. So we're off to a good start. We just have a few that we're working with in good faith. Today, we will be announcing that the Department of Education, in coordination with the Iowa Department of Public Health, is releasing additional guidance for Iowa schools to use in the event of students or staff testing positive, substantial spread in a classroom, and processes for temporarily moving classrooms or buildings to online instruction. Director Lebo and Dr. Badati will go through those guidelines in a little more detail in a moment, but I want to highlight a couple of key points about them first. First, back to school doesn't mean back to normal. There will be enhanced hygiene protocols, social distancing mitigation measures in classrooms and other places, and online education will continue to play a role in educating Iowa kids. Second, I've received a number of questions, I've gotten the question, a number of times about why the state needs to be involved in this at all. Why can't it be left up to school districts and local public health departments? So most Iowans probably don't know that the vast majority, 237 out of 327 school districts, are in multiple counties. 2 of them are even in 5 different counties. So if you look at the map, I don't know which way it is, there it is. If you look at the map, the orange represents school districts that are in 3 or more counties. So the guidance and data, for instance, in the West Des Moines School District, that the West Des Moines School District gets, would come from Polk County, and it could be different from what they get in Dallas County, for example. And if you're in the Nashua Plainfield School District in Northeast Iowa, you're in Chickasaw, Floyd, Bremer, and Butler counties. And that's why I think it's so important for us to have clear statewide guidelines, as well as continue to coordinate with our local public health partners. And I want to just reiterate that they have been key partners throughout this pandemic. And just as we've done throughout COVID-19, these guidelines are based on state data put into context of CDC guidelines. The positivity rate over the previous 14 days and student and staff absenteeism will both be central to informing these local decisions. We're all going to need a great deal of flexibility as we move forward because as we've seen all along with this virus, data and circumstances will change and we'll need to adapt. At the state level, I can assure you that we're going to do our best to provide schools, local public health providers, parents, and Iowans access to the data that they need to make the best possible decisions for everyone. We'll also, that means PPE and making sure they have the tools and the resources. The Department of Education will be sending out a survey to school districts across the state to find out what their need for PPE is. And the state will supply an initial 30-day supply of PPE, and then we'll continue to work with our AEAs, our school districts, and whoever that may be on procurement moving forward. So before turning it over to Dr. Badati and then to Director Lebo, I'd like to add that this entire return to learn process has required a remarkable level of cooperation and collaboration to get this far, and truly will require even more as we move ahead. So I'm so appreciative of the efforts we're seeing from school districts across the state, and really appreciative of the team at the Department of Education and the Iowa Department of Public Health. We owe them a big thank you. So with that, I'll go ahead and turn it over to Dr. Badati.
Thank you. So we know that our schools are critical for providing a wide variety of services for children, and that includes things like social and emotional development, behavioral support, and regular meals. And all of these reasons and more are why it's so important for children to return to school. We also know that educators and families need the tools and resources to do this safely. So as you've heard, Public Health has been working with the Department of Education to help put together some updated guidance for Iowa educators to provide them with the information that they need in order to have a safe return to learning this fall. This guidance is going to include a checklist that's going to help interpret some of the items that we're asking people to do and make it easy to follow and keep track of. In addition to providing this guidance, we know that we need to maintain consistent communication between our educational and public health partners as we move forward, because we're going to continue to learn more. We've already learned more about this virus in the past 6 to 7 months, and we continuously look at data both locally as well as research from other nations to help inform what we know about the virus. I want to talk a little bit more now about transmission of COVID in children specifically. So in Iowa, children under the age of 18 make up only 6% of the reported positive cases. So that means that the children here in Iowa are not the primary drivers of this pandemic. And in fact, we know that children are less likely to become infected, and when they do, they appear to have a less severe illness. Now, we've also seen some scientific reports coming out of other countries looking specifically at contact tracing in school settings. And this has been done in places like France, Australia, and Ireland. And they've suggested that transmission among students is not as likely between each other in a school setting as it is in a household setting. Now, we've also seen some early reports that indicate that COVID cases may vary even among children as a population. So, for example, children who are older, 10 to 17, are more likely to become infected, and children who have underlying conditions might be more likely to have more serious consequences or become infected. Now, all of that, even within what we know about kids, has evolved over time and continues to expand. And it's all consistent with what we've seen so far, in that this virus seems to have a greater and more serious impact as age increases and for people who have underlying conditions. And this is why it continues to be so important for us to focus on protecting our vulnerable populations and to use new data and information as it arises to inform our response and the activities that we perform related to COVID management. A safe return to school is going to depend on our communities and families' readiness, and this is going to include a commitment to the protective measures that we know can help slow the spread of this virus. So that means the consistent use of cloth face coverings when in public. It means socially distancing by 6 feet whenever possible. It means staying home when we're sick or if we've been exposed to somebody who has COVID. And it means washing your hands frequently with soap and water or a hand sanitizer. It's also important to know that there's a plan, to develop a plan for when we identify a case in a school setting, which we expect will happen. And so I want to take a moment to walk through the current public health guidance for what we do to investigate a case of COVID. So this is going to begin with a notification to public health of a positive result. And at first, the first thing we're going to do is public health will recommend quarantine or staying home for all household contacts of that positive case. We're then also going to work very closely with the school and with the family and case themselves to better understand what other exposures could have occurred and what other recommendations need to be made for any other potentially exposed people, whether they're staff or students in any setting. And so schools will work very closely with local public health when they're made aware of a case, and they're going to help determine who would have been in close contact. And right now that means within 6 feet for more than 15 minutes. So we'll work together to figure out where that could have occurred. Was it in a classroom? Was it in transportation on a bus? Was it during the lunch period or another setting? So we'll come up with that list of people who would have been exposed, and the recommendation will be for people who have been in close contact with a confirmed case that they need to stay home or quarantine for a period of 14 days. Now, when we talk about quarantine, that means people who are still healthy but who have been exposed to somebody who has COVID. If that person were to themselves become sick, they should seek health care and get tested as appropriate, and if they were positive, they would then isolate, is what ill people do. Now, it's also important to remember that that 14-day quarantine period right now has to stay for the full time, even if you have a negative test result. So for example, if I was exposed to a positive case and after 2 days test negative, I still need to complete my 14-day quarantine because I could still be incubating the virus. Now, this kind of person and case focused approach between education and public health is exactly the kind of approach we've been taking, and it's something that we're going to continue to adapt to meet the needs of the activities of an individual case and to address potential exposures for staff, students, and families, no matter the setting that they're in. Finally, I'd just like to reiterate that it's important that we continue to remember that this is a very fluid situation and we continue to remain flexible, and we might need to adjust our guidance again in the future as we learn new things and as the science develops, and we'll continue to do that in conjunction with our public health and education partners. Thank you.
Schools are cornerstones in our communities where relationships are developed, passions nurtured, and strong ties built. They also play a critical role in supporting the whole child, not just their academic achievement, and offer essential services for children and families. These are just a few of the reasons why it is so important to safely open schools this fall. Last week, my team met with hundreds of school leaders and answered questions they had about their return to learn plans and their alignment with the state law that unanimously passed last month. These plans give school districts the flexibility to adjust their learning models as needed based on the fluid nature of circumstances in their schools and communities. Now, with the new public health guidance released today, schools have data-driven measures to help them respond to potential and confirmed cases of COVID-19 in their buildings, and clear parameters outlining when it is appropriate to transition between face-to-face, hybrid, and remote learning models for an entire building or district due to public health conditions in their communities. The guidance provides ranges of community COVID activity, suggested mitigation strategies aligning with current guidance from the Centers for Disease Control and Prevention and the Iowa Department of Public Health, and the recommended return to learn delivery model to use for each. The Department of Public Health expertise has been instrumental in establishing these parameters to help districts and non-public schools make these critical decisions. Based on public health's recommendations, on-site learning is the recommended delivery model for most students when county transition rates over the past 14 days are minimal, as indicated by a 0 to 5% positivity rate, and minimal to moderate, as represented by a 6 to 14% positivity rate. A hybrid delivery model that includes both on-site and virtual learning is recommended if county transmission rates are between 15 to 20%, and the school district has a 10% or higher absenteeism rate among students. Districts may also request to temporarily move to primarily remote learning for a school building or district for 14 days in this scenario. If community transmission is substantial and uncontrolled, as represented by a county positivity rate greater than 20% over the past 14 days with healthcare capacity concerns, a temporary move to primarily remote learning for a school building or district may be requested for up to 14 days. My team will meet with school leaders later today to discuss these measures, along with additional health and safety resources we have provided to schools. Schools have invested a lot of time and effort in return to learn plans to ensure learning continues no matter the circumstances. The results are strong, creative plans outlining protocols for the safest possible return for students, staff, and teachers, helping ensure ongoing workplace safety, and establishing processes for determining student learning progress and needs throughout the school year. The Waukee Community School District is surveying their families and giving them the choice of returning to face-to-face learning or fully remote learning. For those students who do return in person, multiple mitigation strategies will be in place to protect students, teachers, and staff. The Clinton Community School District is prioritizing in-person learning for grades K through 5. They will use a hybrid model for upper grade level students, limiting the number of students in buildings at one time. And the district has embedded into its school calendar several opportunities to work one-on-one with struggling students. Central City High School in Lynn County is primarily returning in person, but doing small group homerooms. All students will stay in the same classroom throughout the day and work on computers to access material for all their classes. Students will not mix with other groups, but when needed, students will have access to all teachers for questions and extra help. These are just a few examples as different plans across the state show that there is not just one way to return to school. We've heard from many families and educators over the past few weeks about this topic, and all are passionate about doing what is best. No matter the concern, we all share a common goal of wanting our students to return to a high-quality education environment that supports the many needs of our learning communities. And while face-to-face learning provides the greatest advantages for most students, parents have the option of choosing remote learning based on health conditions or other family considerations. During these times, it is important to focus our efforts on what we can control. We can plan for a range of scenarios and educational delivery models for the school year so we aren't caught off guard. We can be flexible and make adjustments as virus activity changes. And we can and will continue to work together with schools, public health experts, and other partners to make sound and informed decisions to support our families, schools, and communities.
Thank you, Dr. Badati, and Director Lebo. I appreciate that very much. You know, we haven't lived through this kind of pandemic before, so no one fully knows what to expect. None of us are marching down a pre-worn path. For many people, the uncertainty is very unsettling. I hear the apprehension from some teachers, and I understand it. One of my daughters is teaching summer school right now, and will be teaching in-person classes once school resumes. And 8 of our grandchildren will be going back to school this fall. So it's something that I care very deeply about. When I look back at the beginning of COVID-19 in March, which is hard to believe that it's only been 4 months, I don't know where we would be today without the doctors, the nurses, our first responders, truck drivers, grocery store workers, manufacturers, daycare providers, CNNs, and countless others who stepped up and made sure that our families and our loved ones were taken care of during a time even more uncertain than this. Education is fundamental to the well-being of our children, and our teachers are essential to ensuring that our school kids return to learn rather than mark time and lose ground. And I know that together we can do this safely and responsibly. So before I opened up to questions, I want to just share a really quick story. Recently I was in Sioux Center, and I had a young man who was a high school senior come up to me, and he thanked me for letting him play baseball this summer. He said it really meant a lot to him as a senior and to his teammates to get the opportunity to play this last season. You know, we were the only state in the country to reopen summer sports, summer high school baseball and softball. And although Iowans might have mostly heard about those schools that unfortunately ended their season early because of COVID-19, the statistics in both baseball and softball show an unqualified success. 96% of baseball teams finished their season out of 338 teams. 97% of softball teams finished out of 335 teams. And that all began with parents and students simply saying, all we want is a chance to play ball. Iowa schools, the high school athletic unions, coaches, players, and parents worked together to play their seasons safely and responsibly, and are a good example for all of us. We can do this, and we can do this safely. And with that, I'll go ahead and open it up for questions.
Governor, if the Surgeon General said 10% positivity in a community, if they were under that it was safe to go back to school. The WHO has said less than 5% marks controlled transmission. So why is the threshold 15% for 10% of online learning?
Well, you know, there's a lot of criteria that we're taking into the decision. And so I think if you look at the positivity rate, we've said minimal is 0 to 5. Minimal to moderate would be 6 to 14% positivity rate, that we feel that that's adequate for in-school learning. Once we get above that and we have over 10% absenteeism between the staff and the students, then we need to take a look at doing something different. I think what we have to remember is, as you've heard Dr. Badati say, and you've heard Director Lebo say, and I've said multiple times, this is a very fluid situation, and it's going to continue to change, and we're going to have to be adaptable, and we're going to have to be flexible, because we get new information all the time, and none of us should be surprised by that. We have seen that happen from the very beginning, and we have a lot more data today than we ever had when we had our first cases on March 8th. And we're really able to utilize data analytics and drill down to zip codes and districts and take a look at where we're seeing virus activity, what that looks like, do the contact tracing, work with our local public health providers, our state public health, our school districts and parents, and provide them the information that they need so that we can make sure that we're doing this safely and responsibly, but we're looking at the whole child and we're taking a look at everything when we're talking about getting these children the education that they deserve.
Governor, you acknowledged that multiple districts have multiple counties in some instances.
Yep.
So if you're basing positivity rate in a county over the past 14 days, how do you account for one county surging, another being
Yep.
maybe more stable?
Yeah, so that's why we were going to look at it from a statewide perspective. And again, when I talk about the analytics that we have at our access today and that local public health will have, we're working on that right now, and we hope to make that same information to school districts. But the epidemiology, well, maybe I should. Caitlin, do you want to just answer that? They have the capability to go in and answer those questions, but I'll let you talk about that.
Yeah, it's a great question and it makes perfect sense. So, I think having measures and a place to start is always very helpful. And as you've heard, we're looking at ways to make sure that that information is readily available and that it's accessible to everybody so that they're able to see that. So I think that's part of it. And I think what the percent positivity is trying to get at are a couple of things. One is you include that denominator, right? So instead of just having a raw number, is one case in Polk County different from one case in Wright County, having that context of the population base and also of the testing that's going on is helpful. And so that's in part why a measure like that is useful. It also kind of gives you a general sense of what's going on in surrounding areas. So if you're a school district who's a part of a couple of areas and you've got one area with high activity, that's important to know and to keep in mind. I think the other piece, in addition to the percent positivity, is also the person focus, right? We're still going to be focusing on the individual case and who their close contacts have been and what the activities have been. So you're kind of doing both together. You're putting what's going on in a classroom in the context of what's going on in a community. And again, I would say that we're going to continue to take a variety of things in mind and into consideration as we look at this. And it's likely that as the science advances, some of those adjustments will be made, in our recommendations as well.
So are you taking an average of all the counties in a district, or you really, I'm just trying to understand how you're calculating that for a whole district?
Yeah, so I would have the district look at the percentage for each county that they're a part of. And then if they have a county that they're a part of that has a high percentage of positivity, we'd absolutely want them to be reaching out to local public health, and talking with us about what makes sense and also about what they're seeing inside their school. Again, are they seeing absenteeism, or do they have other things that they're concerned about and other things that we should talk about and support them? And again, as we move through this, we're going to learn more and we're going to have to continue to adjust with experience and new information.
So is this subjective to some degree?
I'm sorry.
Is this subjective to some degree then?
I think that there's always a degree of public health and medical decision making that's involved in a response like this, but using information that's objective like percent positivity, absentee rates, and cases or activity in students and teachers all informs how you respond.
So does this mean basically that every student should be seated in a desk when school starts?
Well, I think as Director Lebo indicated and Caitlin and I have said, there's a lot of innovative and flexible, and creative options that are taking place in school districts across the state, and they're going to learn from each other. And part of the angst and the anxiety is the unknown and just getting started. And we've seen this in a lot of other things that we've done. The hospital, our nurses and doctors at the beginning had a lot of anxiety about COVID and what they were seeing in the ER rooms, and we've worked that. So, we know what some of the mitigation steps are that we need to take, so that'll be a part of the discussion. But I think collectively, all of us would like to think that we need to get our kids back in the classroom because the school provides so much more than just academics. They provide social and emotional learning, especially kids with disabilities or behavioral issues. They really rely on our school system to provide them the resources that they need. It's a safe environment. Our teachers are mandatory reporters, and we've seen the mandatory reporting for child abuse almost be cut in half. And so, I mean, it's just all of those things have to be taken into context. And I believe with, if we do this right, we can be safe and responsible in opening our schools up and getting our kids back to school.
Dr. Bedati, if you look at the trend line on testing, there was a bit of a bump up today, but the trend line has shown testing going down in Iowa. What's the reason behind that?
Well, we have the capacity. Iowans just need to test. So we have capacity across the state. And I think after the 4th of July, when people were out and about and we were seeing a little bit more activity, I think people were interested in getting in there and testing. I can't say this enough. I need to remind Iowans that when you go in and you get a test and it tests negative, that's a snapshot in time. So that does not mean that, if, to Dr. Padati's point, if you've been exposed, you need to think about that 14 days, self-quarantine. And if you do get tested and it's negative, that's good. That's an indication that within those 14 days that you're not positive yet. But if you start to show symptoms, you might want to go again and get tested or continue through that 14-day period. Do you have anything that you want to add to that?
Governor, Iowa currently has 8 counties in the red zone designated by the White House, and the White House recommends public officials close bars in those areas. Do you plan to follow that guidance and close bars in some parts of the state?
So what? No, it's something. Everything is on the table, and I've said that before. So we're going to continue to look at, and with the positivity rates and our ability to look at the data and do the analytics, the majority, I think 16%, has been between 20 and 25-year-olds. If you add 19-year-olds into that, 18% of the positivity rates are attributed to them, and it's social gatherings. It's in the bars, it's in their homes, it's at the lakes, and so we have ramped up. That press release, I think, hit this morning, where we'll ramp up enforcement on our bars and restaurants. And so the first offense through the bars will be a $1,000 fine. If they get a second offense, it'll be a 7-day suspension. And the third offense will be a revocation. And so we need them to know that we take this seriously, and we know where the increased positivity is coming from. And I do have the option, like I've done before, if we can attribute that to some of the hot spots that we're seeing, especially as we're trying to ramp down the numbers so that we can have a safe environment for our kids to get back to school and to get through COVID-19 until we can get it stabilized again, then we will. But right now, when we looked at the data, we're gonna ramp up the enforcement. We'll take a look at that and see if that has an impact. And if we have to do more, we will do more. Right now, in the healthcare declaration, I mean, we still, for any gatherings over 10, we say that you should social distance. I mean, and we've said from the very beginning. So that's still in the declaration. So people, you need to social distance. If you can't social distance, get a face mask or have your face mask on and social distance. Wash your hands often, and if you're sick, stay home. And those same guidelines continue to apply.
Will you lay out specifically if a student or teacher or staff at a school tests positive? We see from the guidelines that person will go home.
Right.
But more broadly, do the rest of the kids in class, do all the students exposed to a teacher, how does the district handle that infection?
Yeah, so right now it's going to depend on the activity, right? So how close were you to other people and what activities were you performing? So we're going to use that 6 feet for more than 15 minutes, and that's why it's so important that local public health and schools are working so closely together to help assess what those activities would have been. And it's going to look different, right, depending on the age of the student, depending on the activities, the setting, the space of the school, and what measures, what preventive measures they've put in place. So it's going to be about assessing the activities that would have put people within 6 feet for more than 15 minutes, and then going from there.
So that's, 2 more questions. That's the local schools call them? About how to...
Yeah, so it's an example of a place where schools would be working with local public health. So the case notification in accordance with Iowa state law comes to public health. We perform a case investigation and we ask those questions. And so we work with parents or families or teachers or employers or whoever is relevant for the setting and the person and the exposure.
Governor, may I ask you about masks generally?
Yeah, yeah.
So I think the court system is requiring masks.
Yeah.
You're not requiring masks in the school system, right? And generally you haven't mandated masks in Iowa.
Right, right.
We've seen other states move that direction
Yep.
after their conditions worsened.
Yep.
Why not? And,
Well-
and why not in schools? I mean, it makes
Yeah.
sense in courts. We're all wearing masks.
Yep.
Mostly.
Yeah, well,
And-
and I think most of Iowans are, so thank you. We're doing the thing, you're being
Well,
personally
you're-
responsible.
you're-
Yeah, but I think Iowans are, so I think there's a lot of different ways that we can approach that. And we've not told schools not to wear masks all along. We've said if you can't social distance, wear a mask. We know that those are two things that can help slow the spread and have an impact on COVID-19 in our state. So, I believe that Iowans are doing the right thing, and I'm doing it through a PR campaign, Step Up, Mask Up, and we're encouraging Iowans to get out there. If you can't social distance, or even if you can, and you're out in public and you're around a lot of people, or larger social gathering, wear a mask. If you wash your hands often, if you're sick, stay home. So, a lot of the states, they've done that, but they've said there's absolutely no enforcement. They've put it right in the declaration. We're going to issue a face mandate, but we're not going to enforce it. And if you look at some of the states and the timelines that they actually issued mandate, the cases are still rising. So, it's just there's not a silver bullet. There's not a single answer. But we do know that if we can social distance, if you can't, wear a mask, especially if you're in large gatherings, wash your hands often, and stay home when you
But
can.
it seems
So,
like what you said is a contradiction. I mean, you either believe that masks work or they don't.
well,
And the
so
science
where,
reports that they
well,
work.
I don't, but there's people that would tell you just the opposite.
Well, I
So
know,
we
but
can
they-
all
they do
find.
not know what they're talking about.
Well-
Dr. Padati, I'm sure she believes that masks work.
I didn't say, I have said from the beginning.
Right.
I have been consistent in what I have said, and I have encouraged all Iowans to social distance, be responsible. If you can't, wear a mask. If you're sick, stay home, wash your hands often. We have said that since March 8th. We haven't wavered from that. We all have a responsibility to do the right thing, and I believe that Iowans are. But we're going to watch the data. And if we continue, and this would be also based on the recommendation that come from the epidemiologists in the Department of Public Health, that if we continue to see our positivity rate increase, our hospitalization rate increase, then we have to step back and we have to take a look at if there are additional mitigation efforts that I need to put in place, like enforcing I have in the Declaration of Health proclamation, I say that different about every time I say it, but you know what I'm talking about, right now, that if you're in a group over 10, you need to social distance. People aren't doing it. So, I have to appeal to people, I have to appeal to Iowans. We're in this together to do the right thing. Our 20-year-olds are not very likely to be impacted unless they have underlying conditions by COVID-19. But guess what? Their parents could be, or grandpa and grandma could be devastated by COVID-19. So it's great that you're getting together with your friends and you're hanging out at home and you're in the streets and you're partying and you're having fun, but do it responsibly. We know by the data where the positive numbers are coming from. So we've taken our first step. We'll see what happens there. I'm telling those kids, get your mask on, hang out, have fun, do it responsibly. If our numbers continue to go up, we'll take a look at what we've got to do next.
But Governor, the positivity.
This is the last question, by the way.
The positivity rate you mentioned, Dr. Pinati, was 6% among children under the age of 18. But kids have been out of school since March. Is there any reason to believe that once they're back in school altogether, that rate could go up? Is there any
Yeah, well,
consideration?
I'd look at our daycare statistics. We've had kids in daycare throughout this pandemic. Thank goodness for our daycare providers that are providing daycare for our essential workforce so we can help Iowans continue to work and keep this economy up and going and protect the livelihoods of a lot of Iowans out there. And the statistics are pretty staggering on it, the low impact of COVID-19 on our students. Where we're going to have problems is going to be from educator to educator or for adults. It spreads more. You want to talk about that just a little bit? you know, when teachers are getting together and cohorting, I mean, that's when we really have to think about, because that's where the spread is more likely to occur.
Yeah, so a great question, and just a point of clarification. The 6% is of positive cases that have been among children, so just a slightly different denominator there. But your question about, you know, the setting, right, is important. And so, again, what we look for is information from what we've seen here in Iowa, for example, in our daycares, from what we've seen in other states and other countries. And as I mentioned, in other places where children have started to go back, it does appear that kids are not the drivers, meaning that they're not the ones who are transmitting in these school settings. Again, going back to that research from places like France, Australia, and Israel, where you see that transmission doesn't appear to occur as much among students in a class setting as it does in a home setting. So again, it's an example of a place where we continue to learn more all the time, and we're going to continue to learn more, and we'll keep adjusting going forward as we need to.
Thanks, everyone.
I do have one more thing. I'm supposed to remind everybody of this. Beginning next week, we will be returning to a twice a week scheduled press conference, at least through August. They will be on Tuesdays and Thursdays at 11 a.m. at the Maytag Auditorium at Iowa PBS in Johnston. And I want to thank them again for giving us the opportunity to reach out to Iowans. So we'll be doing a press conference on Tuesdays and Thursdays at 11 a.m. and I really appreciate them helping us make that available. Thank you.
Thanks, everyone.
So like, you have confirmed, actually confirmed, right? Yeah, the school